So I'm sitting here chatting to Jonathan. We co-wrote the book, the Bridge Between Medicine and Dentistry, which was the concept devised by Dr. Leslie Fang, who I'm sure many of you enjoyed his COVID lectures that he so generously shared over this time. And we were just having a talk about why we felt we wanted to get involved with a project like this. Jonathan, what's your background?
Hi, Elaine. Hello to everyone who's listening. My background is orthopedic, specifically knee, and I've been a knee specialist now for the better part of 20 years. I, of course, work in a hospital and I work with the medical team a lot. But I think there are a lot of problems that we both work with that have a lot of similarities. And I think that's why we've called the book The Bridge, because you're dealing with the same type of infection that I am. And I think it's just interesting to see where the common ground is and maybe perhaps where some of the differences are. But we've put this all together in an easy format for people to be able to use, because although the information's there, it can be quite difficult to have at your fingertips.
Yeah, I think that's it. We have patients that come to see us as dentists, and obviously our primary concern is what's going on in their mouths, but often the very first thing that we're doing is updating medical history. And of course things in medicine are changing, just as quickly as they are in our profession. So for us to keep up to date with what we need to know about that's relevant to us, but also what are the consequences of the various medications that people might be on. So, and we don't all have a Jonathan at on our shoulder that we can just double check with. So I think that connection, dentists get a lot of reassurance by double checking with the medical side of things that, that what we're then doing is appropriate.
Yeah, and I think in some extent you're in an unenviable position, because I can always go to my anaesthetist or a doctor in the hospital who are really very accessible, and I appreciate that maybe finding a physician is not quite as easy if you're in your own practice, whether it be NHS or private sector. You just don't have those people on hand. And so a lot of what's been distilled in this book would be the sort of questions that I might ask my medical colleagues.
Yeah, I mean, our usual go-to has been either the BNF or some form of looking things up on Google. And of course those were the very documents that we used to double check the book, the content in the book.
And the BNF's a really useful book, but it's not an easy book to use. It's particularly not an easy book to use in a hurry. If you're perhaps looking up one drug, that's fine. But sometimes you need to look up multiple drugs. And certainly when we were putting together the UK version of The Bridge, I spent a lot of time looking at the BNF and other places to get the information, but it's not all in one place. And that's what we've tried to do with The Bridge, is to put the commonest drugs into the book, both with their generic names and their trade names, and all the interactions, and specifically for the dental community, the interactions with the drugs that you are prescribing. And many of those might be things like the local anesthetics, but there are multiple interactions with local anesthetics, as I'm sure the audience know.
Yeah, and what I really like about how Leslie has guided the format is that it's very easy to follow through, and it's very easy to find exactly what it is that you're looking for.
Yeah, and I think it's the sort of book that you can just lay out on the desk, because it's spiral bound and you can actually just read through the chart, and it's a really easy to read book. And in the current situation we find ourselves in, it's also handily wiped clean, so
Yeah.
we can disinfect it. we can fog the book or subject it to ultraviolet light or whatever. But on a more serious note, I mean, I think we've all been in situations where we've come across a drug that we're unfamiliar with. Well, we've included the drugs in the book. We've put in all the new drugs. We've got sections on the new anticoagulants. And then there are other sections. sort of for those of us who are a little bit longer in the tooth, sometimes you need just information to reassure yourself that the knowledge you've had for the last 20 years is still current. And again, we've covered that sort of area. So we've covered some of the more challenging areas like osteonecrosis, where you just can't, from a litigation point of view, to be seen to be out of date.
Yeah, and that is one of the challenges, of course, in dentistry, is that whilst we need to be up to date on all this information, it isn't our core subject. So again, having an easy reference, especially you mentioned the novel anticoagulants. I mean, that's been a complete change for dentists. We knew how to deal with warfarin, but it's been quite a learning curve personally for me to try and understand the novel anticoagulants, and I learned a lot by helping with the editing of the book. So
yeah, and it's the same for us. Doing joint replacements and surgery on people on these novel anticoagulants is a real headache because they're not reversible, and you don't have that easy go-to situation. You may not reverse someone very often, but knowing you've got it is reassuring. So it just makes you that little bit more tentative about proceeding. And I think we've covered that area pretty thoroughly, along with other areas like pregnancy, children, breastfeeding, all of these areas where we just need to be sure we are up to speed with what's happening with our patients and particularly the medication they're on.
Yeah.
So I think probably what we've got is a book that a lot of what's in here is what I do. In fact, most of what is in this book would apply to my practice, almost directly translated into my practice. And I think that what I learned in helping to edit this book with you, Elaine, was actually our practices in many respects were more similar than I thought. We both understand implants, we both understand infection and pain and etc. So it should hopefully be a useful book for dentists, and we will update it regularly. So the US version is also updated regularly, but we will make it specifically for UK advice.
Yeah, and I think that inclusion and cross-referencing that we've done across all the available databases in the UK, and translating the guidance into being absolutely relevant for that bridge between medicine and dentistry in the UK was a huge piece of work, but it really has come together nicely in the book.
Yeah, and some of the information in here required freedom of information requests. It's just not accessible.
Yeah.
And and nobody likes to be Googling in front of their patients.
No.
So I think it would be, we'll do some updates, we'll do some little updates, I think, going forward on some of the different sections of the book. So if anyone's interested in it, we'll put some little pieces out there on topics like managing infection, and then perhaps some of the more esoteric conditions that you may not come across so regularly.
Yeah, I think that would be really interesting just to explore some of those.
And if anyone wants the book, Elaine, just tell everybody how they get hold of it.
So I'll put the link in the blurb underneath the video. So it's the Shopify Cherry Bank page, and you can click on that and just order online, and we'll get it off to you the next day.
Good. Oh, it's great to talk to you.